Hey guys, this is discussion 8. Let's get into it. You're dispatched with a 55-year-old male with chest pain. So you arrive on scene and you find the patient in his house, sitting in his living room, holding his chest. He's clammy and he's pale. So you put the pulse ox on, and his hand feels cold. So you get him on the cot, you get him in the back of the truck, you get some vitals on him, and his pulse rate for this scenario is 122. Blood pressure is 150 over 110. Respiratory rate is 22, and pulse rate's 94, or SpO2 is 94. So now it says, so pause the video, and now I'm going to list out the mandatory things you would need to know to successfully recognize and manage this case. So, 1, you need to know how to read a 12 lead. Because being a cardiac patient, it is important that you get a picture of the 12 lead and send this to doctors so they can make calls on what to do with him at the hospital. I mean, other than placement of the 12 lead, how to read it, and then how to recognize a heart attack, when it comes to interpreting the data that the 12 lead tells you, and also depending on the 12 lead tells you can go into right-sided view of the 12 lead, where you move the 4 lead to the opposite side, or before the opposite side, or a 15 lead if it's posterior, and you want to get a better picture of that. But pathophysiology wise, we need to understand, with like nitro, that it's going to drop the blood pressure. It's going to open up his arteries to hopefully help with whatever is wrong, which is most likely a clot in one of his coronary, or in one of the arteries of the heart that is causing this heart attack, cardiac event, whatever you want to call it. Yeah, and if there's a clot or a clot, the aspirin is something we might give because it makes the platelets slick and not stick together, to help the clot not grow anymore. So assessment on this patient, he doesn't have any allergies. His symptoms of it are, pale, cool, diaphoretic, and holding chest pain, or holding his chest. He doesn't have any past medical history that's pertinent. The onset was, he was sitting down watching TV. Nothing makes the pain better or worse. He said the intensity was like this intense pressure and in his chest. It radiates up to his right arm and all the way down his right arm. The rate of the pain for him was a 10, and it started about 3 hours ago. Yeah, I mean, I don't have really any first-hand experience with cardiac patients. I haven't run any yet in clinicals, and I don't work as an EMT driving an ambulance anyway. So I don't really have any first-hand experience with cardiac patients. Yeah, which is which is the management pearls. That's my understanding of what they want, is bits of information from my experience, which I cannot give, but I am looking forward to your interpretation, your guys' interpretation, and giving me some feedback. Yeah, I hope to really learn from this discussion. Thank you, guys.